Moving and handling are important parts of the home carer role and are involved in everyday activities like cleaning, cooking, toileting and bathing. According to the Manual Handling Operations Regulations, manual handling is the moving, lowering, pushing, pulling, carrying or supporting of a load using your hands or your body. A load can either be animate, a person for example, or inanimate, like a box or table. What you may not know is that if you don't follow the principles of moving and handling, these tasks could present a significant risk of back or other musculoskeletal injuries to both you and the service user. At the very least, it may mean loss of income and back problems later in life. For your employer, colleagues and service users, it could mean loss of experienced staff, changes to work schedules, increased workload, and loss of continuity of care. This video will help you understand how to reduce the risk of back and other injuries by describing your rights and responsibilities under health and safety law, showing how you use and misuse your back at work, introducing the efficient moving principles and good posture, and demonstrating how you can safely assist service users to move with and without special equipment. The Health and Safety at Work Act, Management of Health and Safety at Work Regulations, and the Manual Handling Operations Regulations give rights and responsibilities to both you and your employer. As an employee, you have a right to safe systems of work, safe equipment to work with, safe use, handling and transport of objects, information, training and supervision at work, and a safe working environment. Your responsibility is for the things you do and don't do, as these affect both your health and safety and that of the service user. You also have a duty to be familiar with and follow your employer's moving and handling policy and their systems of work. If there are failings in these systems or in the health and safety policy, you must report them. Meanwhile, your employer is obliged to carry out a moving and handling risk assessment of the risks you and each service user faces. The following areas will be covered in this assessment: task, individual capability of worker, load, and environment and equipment. Firstly, your employer must answer questions about the position you have to adopt when doing a handling task. For example, whether it involves carrying, stretching or stooping, and how far, often and long you have to hold the load. The next part of the assessment addresses risks to the carer. Typical questions would be, is special training required for this task? Or, is this task hazardous to a pregnant woman or someone with joint problems? Then, your employer must assess the types of load you handle, including the service user. Criteria for assessing inanimate loads include size, shape, fragility and bulk. If the handling task is moving or assisting a service user to move, factors such as the service user's age, ability to stand, pain, fatigue, cognitive and cooperative ability, and communication should also be taken into account. Regarding environment and equipment, your employer must decide whether there is enough space for you to move safely and whether there are obstacles that might hinder movement. Other features to assess are the equipment you use in your job, lighting, and the presence of steps and slopes. A risk assessment will identify any risks and enable your employer to draw up a care plan for each service user. These plans are kept in service users' homes and at your employer's office. They specify how you should handle and move the service user for each task involved in a typical visit and foreseeable emergency situations. You must comply with them, advising your manager of changes that may affect the safety of those tasks and of any accident you or a service user have involving moving and handling. This formal level of risk assessment forms a vital part of the care plan. But before you carry out any moving and handling task, you should always make an informal judgment as to the potential dangers involved and act accordingly. Now that you know your obligations under health and safety law, the next step is to understand the types of physical movement that can cause back injury and how they appear in the domiciliary setting.